What is it like to have aortic stenosis? A presentation by Zach Willie. In short, aortic stenosis is a narrowing of the aortic valve which restricts blood flow from the left ventricle to the aorta. On the right, you'll see a diagram of the aortic valve. The top shows a normal aortic valve, which opens up all the way and closes all the way. But on the bottom, you see an aortic valve stenosis. When it opens up, it does not open up all the way, and when closed, it does not close all the way, which causes more pressure and, in the end, after many years, a deterioration of the valve. The heart, which is the organ on which aortic stenosis affects. The function of the heart is to take deoxygenated blood, pump it to the lungs where it then picks up oxygen, and then pumps it back out to the rest of the body. The heart has two atriums, a left and the right, which are located on the superior end of the heart, and two ventricles, left and right, on the inferior end of the heart. These are called chambers. The aorta, which is one of the great vessels that make up the heart, is located in the left atrium and is where you see aortic stenosis. Valves, which are important to understand when looking at aortic stenosis, are passageways from one chamber to the next and are one way. And on the right, you'll see a diagram of the heart and both ventricles and both atriums and the great vessels. The valves of the heart. I found this important to include a slide of just valves because this is where aortic stenosis takes place. The function of valves in the heart is to prevent backflow of blood. I stated before, valves are passageways from one chamber to the next. The heart has four valves, two to control blood from the atrium to the ventricles, which are called mitral and tricuspid valves, and two to control blood flow out of ventricles, which are aortic and pulmonary valves. On the right, you'll see both the mitral and tricuspid, which are located from the atrium to the ventricles, and then you'll see the aortic and pulmonary. A deeper look at aortic stenosis. Aortic stenosis is an narrowing of the aortic valve opening. This is due to the narrowing of the valve as it restricts the blood flow from the left ventricle to the aorta. The restriction of blood flow then causes the valve to have trouble opening and closing. With the valve not opening and closing properly, it causes an increase in pressure. This may also cause a backflow. Many times people are born with this condition and never know it until it worsens, since it has to be diagnosed by a doctor that looks directly at their heart, do an echocardiogram or an ultrasound. Causes of aortic stenosis. The most common is congenital heart defect, which means they were born with the condition and is diagnosed at birth due to a child having a bicuspid aortic valve, which is two cusps and not three, as is the norm with most humans. Calcium buildup on the valve. This cause happens over time, usually seen at old age, and is when deposits of calcium build up on the cusp and then stiffens them. The third cause is rheumatic fever. This fever may cause scar tissue on the cusp, which can narrow the valve or cause more calcium to build up. Once aortic stenosis has been diagnosed, this brings us to the question we began with. What is it like to have aortic stenosis? Some effects of having aortic stenosis: abnormal heart sound, also known as heart murmur, chest pain or tightness with activity, feeling faint or dizzy or fainting with activity, shortness of breath, especially when you have been active, fatigue, especially during times of increased activity, heart palpitations, sensations of rapid fluttering heartbeat. People who have aortic stenosis may have one or all of these side effects. Once diagnosis has occurred, treatment is determined by the severity of the valve. Oftentimes, the valve will need to be replaced altogether. Sometimes repair may be needed, which is done by separating the cusp. Balloon valvuloplasty, usually is seen with infants or children, is when a long, thin tube is inserted up the valve and then inflated to open it. Oftentimes, blood pressure medication is prescribed to help counteract the effects of aortic stenosis. What does this have to do with anatomy? It involves the heart, which is a main component of the cardiovascular system. It affects how the heart works and how it pumps blood out to the rest of the body. In the clinical setting, it helps with understanding the effects that heart conditions can cause. Famous cases of aortic stenosis. I picked these two men because of their involvement in athletics and the fitness world, while battering heart defects. The first I'm going to look at is Arnold Schwarzenegger. The famous bodybuilder and actor had to undergo a heart valve replacement surgery in 1977 due to aortic stenosis that doctors believed he was born with. Many believe the strenuous life of a bodybuilder only made his condition worse, although he went many years without needing any surgery. The valve replacement he received only lasted about 20 years, as he had to undergo yet another replacement surgery recently in 2018. The second famous case we'll look at is Fred Hoiberg. Now Chicago Bulls coach and ex-Iowa State men's basketball coach, was in the prime of his career when he went down to practice. Up until this point, Fred had no idea he had a heart condition. After this incident, as it was discovered that he had a bicuspid valve, which he then had surgery on, but his career ended shortly after. The interesting case with this is that he quit his career right away, as unlike Arnold Schwarzenegger, who kept living an active lifestyle. Fred himself said that he did this because he already had children and did not want to risk putting himself in any danger of this becoming fatal. How anatomy has helped me understand this. Anatomy has greatly helped me understand this condition, which surprised me because I personally have aortic stenosis, and I thought I had a good understanding of it to begin with. It helped me understand how heart valves work, which is the most important aspect with this condition. It also helped me understand how this condition can cause high blood pressure in the lungs, such as I have with my condition. Overall, this course gave me a better understanding of the heart as a whole and how important it is for all the components of the heart to work properly. This really stuck out to me because with aortic stenosis, just a little part of the heart that does not work properly, the valves, causes such a big impact on the rest of the body. My personal experience of living with aortic stenosis. My diagnosis came 3 months into my life when I wasn't eating right. My mother then took me into the doctor for this reason, and through different tests, diagnosed me with aortic stenosis. The reason for my diagnosis of aortic stenosis is interesting. It is due to a medication that a doctor prescribed to my mother while she was pregnant with me. Shortly after getting diagnosed, I underwent a balloon valvuloplasty, which consists of a balloon being sent from an artery by my groin to my heart, then expanded to open it up. Following the surgery, I had checkups every couple of years that consisted of ultrasounds, x-rays, and full evaluation by the doctor that carried out the surgery. Although once I started growing more rapidly due to puberty, they started seeing that the valve got worse as I grew, almost in perfect correlation. To describe this, say I grew 3 inches and 30 pounds, you'd see a huge worsening of the valve. But say I grew a half an inch and 5 pounds, you'd see a small increase in severity of the valve. From my freshman to junior year of high school, I got restricted to lifting no more than 30 pounds. But as my growth flattened off, so did the worsening of my valve. Then all seemed good after that for 2 years until 1 month after the state tournament my senior year when I had my annual checkup. This was a crazy 3 months of my life because I went from having the biggest experience in wrestling of my life leading up to this point, which was extremely important to me, to having a checkup. The results showed that I had abnormal blood pressure in my lungs because of my aorta and my aortic stenosis. My doctor then put me on lisinopril, which is a blood pressure medication, just a low dosage, and said I'd have to have a procedure to see if we should be worried or not and get more exact numbers. This really worried me because up until this point in my life, I had no impact by aortic stenosis because could not remember when I had the procedure at 3 months old. This is So 1 month later, I went to Mercy and had the procedure, which is something I'll never forget. This is because they said it'd be similar to having the balloon surgery that I had at 3 months, but with a scope instead of the balloon, and that I'd also be awake. This whole morning leading up to the procedure, I was freaking out because imagine having a surgery of something going into your heart, but having to be awake. Although I wasn't entirely put under, they still gave me something through an IV where I could feel almost nothing but couldn't remember most of it. The results came back, and thankfully they showed that the medication I was on helped enough that I probably won't need the surgery until some years later down the road. The reason why I say I'll never forget this was imagine being 18 and being told you have to have a heart procedure. Worse than that, having to be awake. All morning, like I said, I was freaking out because the doctor was walking me through what it would be like. And all I could think about was, I'm going to be awake. I'm going to be awake. I'm going to be awake with something in my heart. But it ended up turning out okay, especially once the results came back. Personally, the hardest part about having aortic stenosis is that there's almost nothing I can do about it, and knowing that I'll have to have surgery down the road. The second part came before I had the procedure at the end of my senior year, because I had just committed to Grandview University to wrestle, and there was a chance that I wouldn't be able to wrestle anymore, and never get the chance to wrestle in college for a national title. Thank you for listening to my journey through aortic stenosis and learning more about the condition.